Unlock the secrets to lifelong penile health, what you absolutely can't afford to ignore. Imagine living your life not knowing you possess a hidden barometer of your overall health, a critical indicator that whispers warnings about your well-being. What if ignoring these subtle signals could lead to irreversible damage, not just to your sexual vitality, but to your very life? If you've ever wondered how to genuinely protect and optimize one of your body's most vital organs, then you are at the precipice of essential knowledge. A leading urologist and pelvic surgeon is here to dismantle common myths and reveal the 10 crucial things you absolutely must never do, or rather, the vital practices you must embrace to safeguard your penile health. This isn't just about sexual function, it's about your heart, your hormones, your happiness. Stay with us until the very end, because the 10th revelation is guaranteed to challenge everything you thought you knew and leave you astonished, potentially changing your approach to health forever. Before we dive into these life-altering insights, if you found value in expertise, please subscribe and hit that notification bell. We constantly share vital health education, and with only 20% of viewers currently subscribed, you might be missing out on information that could dramatically improve your life. Join our community and help us spread this critical knowledge around the world. Don't ignore your penis, a window to your overall health. Your penis isn't just a sexual organ, it's a sophisticated barometer reflecting your entire bodily health, offering profound insights into your internal state. Many men unknowingly overlook its subtle cues, failing to realize that issues like erectile dysfunction, ED, are often not isolated problems, but rather early warning signs of more widespread systemic concerns. Astoundingly, studies have shown that men who experience the onset of erectile difficulties face a 14% higher risk of suffering a heart attack within 7 years. This is why medical professionals often refer to ED as the canary in the coal mine, signaling underlying cardiovascular problems long before they manifest as chest pain or other severe symptoms. When you consistently experience strong erections and a healthy sex drive, it's a powerful testament to excellent blood flow, balanced hormone levels, a robust nervous system, and a positive psychological state free from overwhelming stress. It also indicates that you're avoiding harmful substances that could compromise its delicate functions. Paying attention to these signals is paramount, as early recognition allows for timely intervention, protecting not just your sexual well-being, but your entire physical health. Resist the urge to DIY, the dangers of unproven remedies. In the quest for a perfect penis, many men fall prey to the alluring yet dangerous world of do-it-yourself remedies. As a urologist, Dr. Malik has witnessed the full spectrum of ill-advised practices, emphasizing unequivocally that there is no safe or effective at-home concoction that will magically increase penile length or girth overnight, regardless of what sensational advertisements promise. The desperation surrounding perceived penile inadequacies often drives individuals to try unproven and often hazardous methods. Take, for instance, the myth of pouring apple cider vinegar on the penis for growth, a claim that defies all medical logic and could cause severe irritation or chemical burns. These unverified methods, while tempting, are frequently unsafe and carry significant risks of permanent damage. A prime example is jelqing, a manual exercise technique where men use their hands to stretch the penis, often with excessive force. While proponents claim it can increase length, it frequently leads to microscopic tears and fractures within the penile tissue over time, which can ultimately result in permanent erectile dysfunction. Urologists routinely encounter young men who have inadvertently caused irreversible damage through excessive jelqing. Similarly, creating homemade constriction bands, such as using construction nuts or plastic bottle rings, has landed countless individuals in the emergency room. These dangerous improvisations can severely restrict blood flow, leading to extreme swelling, tissue death, and requiring emergency surgical removal, often with specialized tools from the fire department. Opting for properly designed, medically approved constriction bands, readily available for a nominal cost, is a far safer and more sensible alternative. Maintain impeccable hygiene beyond surface cleanliness. Maintaining meticulous hygiene of your penis is a fundamental aspect of its health, yet it's an area where crucial details are often overlooked, especially for uncircumcised men. While most individuals understand the basic premise of washing, those with a foreskin must remember to gently retract it and thoroughly clean and dry the area underneath. Failure to do so can lead to a buildup of smegma, a cheesy substance, and create an ideal environment for bacterial and fungal infections, resulting in conditions like balanitis, characterized by inflammation, redness, and discomfort. Beyond immediate discomfort, a more serious concern arises if the foreskin becomes too tight to retract, phimosis. While penile cancer is exceedingly rare, it can develop discreetly, and an unretractable foreskin can tragically obscure early warning signs, delaying diagnosis and treatment. Therefore, it is essential to be able to fully retract your foreskin. If you experience difficulty, consulting a urologist or doctor is vital, as this condition can often be reversed with creams, specialized devices, or in some cases, a circumcision. Regular inspection of your penis during cleaning also allows you to notice any unusual changes promptly. However, it's equally important to avoid overly aggressive cleaning. The delicate skin of the penis is not meant for harsh scrubbing or strong scented soaps. These products can cause irritation, dryness, and even microscopic lacerations. A gentle wash with mild soapy water, allowing it to run over the area, is sufficient to keep it clean without causing harm. Heed the warning signs. Never ignore pain or changes. Your body has a sophisticated system for signaling distress, and your penis is no exception. Ignoring pain or any unusual warning signs is one of the most perilous mistakes you can make for your health. If you notice persistent pain, strange lumps, sores, discharge, or any other concerning changes, it is imperative to seek medical attention promptly. These symptoms could indicate a range of issues, from sexually transmitted infections, STIs, or urinary tract infections, UTIs, to more severe conditions. For instance, blood in the urine, while sometimes harmless, can be a red flag for kidney stones, bladder stones, or more concerningly, bladder cancer. Similarly, an unhealing ulcer or lesion on the penis could be a sign of penile cancer, a very aggressive, though exceedingly rare disease. Dr. Melick recounts heartbreaking cases where men, out of embarrassment or fear of judgment, delayed seeking help for such ulcers, leading to advanced and devastating stages of penile cancer. It's understandable to feel vulnerable or anxious about discussing genital health with a doctor, especially if you fear judgment regarding your sexual history. However, your health is paramount. If you feel uncomfortable with one doctor, seek another who makes you feel safe and respected. Early detection and intervention are crucial for better outcomes. Addressing a problem in its nascent stages almost always leads to less invasive treatments and a significantly higher chance of full recovery. Prioritize safety and control, enhancing pleasure, preventing injury. In the realm of intimacy, nothing is more appealing or liberating than safe sex. When you're not burdened by worries about sexually transmitted infections or unintended pregnancies, you can fully surrender to the moment, fostering a deeper connection and experiencing uninhibited pleasure. Always prioritize safety by using condoms, and don't hesitate to experiment with different types to find what works best for you and your partner. Involving your partner in this decision-making process can also enhance intimacy. Beyond STIs and pregnancy, maintaining control during vigorous sexual activity is also vital to prevent acute physical injury, such as a penile fracture. This traumatic event occurs when an erect penis bends sharply, often by accidentally striking the pubic bone rather than entering the vagina, causing a rupture of the tunica albuginea, the fibrous casing around the erectile tissue. A penile fracture is a surgical emergency, typically accompanied by a distinct popping sound, immediate and severe pain, and rapid, significant swelling that can resemble an eggplant. Delaying treatment can lead to long-term complications, including erectile dysfunction, in up to half of affected individuals. Therefore, if this occurs, immediate medical attention at the emergency room is critical for surgical repair, which preserves future erectile function. To mitigate this risk, maintaining control by holding onto your partner's hips can help regulate pace and angle during intercourse. Additionally, incorporating lubricant is a simple yet profoundly effective way to enhance safety and pleasure. Lube is not a sign of a problem. It simply makes things smoother and more enjoyable. It's perfectly normal for natural lubrication to vary due to factors like aging, menopause, medications, or genetics, and it never reflects a lack of arousal. Embrace lubrication as a tool for more comfortable and safer intimacy. Keep it cool, protecting testicular health and fertility. Your testicles are remarkable organs strategically positioned outside the body for a very specific reason. They require a slightly cooler temperature than core body temperature to optimally produce healthy sperm. Exposing them to excessive or prolonged heat can have detrimental effects on both your fertility and potentially your testosterone levels. Factors such as frequent use of jacuzzis, hot baths, or steam rooms can significantly elevate scrotal temperature, impacting sperm quality and quantity. Therefore, it's advisable to limit your exposure to these environments. Furthermore, everyday habits can inadvertently contribute to unwanted heat exposure. When using a laptop, always place a buffer, such as a pillow or lap desk, between the device and your genitals to shield them from direct heat emissions. Similarly, carrying your phone in your back pocket rather than your front can help minimize heat transfer to the testicular area. Being mindful of these seemingly small details can play a significant role in preserving your testicular health and reproductive potential in the long run. Gentle pleasure, rethinking masturbation for better partnered intimacy. While masturbation is a natural and healthy part of human sexuality, the manner in which it's practiced can surprisingly impact your partnered intimacy. Dr. Malik often observes a phenomenon sometimes referred to as death grip, where men masturbate with an exceedingly strong and aggressive grip. The problem with such intense stimulation is that it creates a level of pressure and friction that simply cannot be replicated by a vagina, mouth, or any other natural orifice. Over time, your body can become habituated to this extreme intensity, leading to a desensitization that makes it difficult to achieve or maintain arousal and erections during sex with a partner. Your nervous system essentially learns to expect that specific, often unrealistic level of stimulation. Therefore, being nice to it means adopting a more gentle and mindful approach to self-pleasure. Try to masturbate in ways that more closely mimic the sensations of partnered sex, utilizing lubricants and focusing on pleasure rather than just rapid release. Moving away from a hurried, shameful corner experience towards a more sensuous and deliberate act can foster a healthier relationship with your sexuality and enhance your capacity for fulfilling intimacy with others. Holistic health is penile health. Quit smoking and embrace wellness. The profound connection between your general health and penile function cannot be overstated, and few habits are as detrimental as smoking. Unequivocally states that smoking will 100% kill your erections by severely compromising blood flow, a critical component of erectile function. Beyond erectile dysfunction, smoking is also a leading cause of bladder cancer, a particularly aggressive and life-altering malignancy that often requires extensive and invasive treatments. Your lifestyle choices fundamentally dictate your penile health. While it may not be glamorous or quick, a commitment to overall wellness is the most powerful preventative measure. Remember the earlier discussion. Erectile dysfunction is a potent biomarker for cardiovascular disease, indicating compromised blood vessels throughout your body. To foster robust penile health, embrace a balanced diet rich in nutrients, drastically reduce or eliminate smoking and excessive drug use, and minimize alcohol intake. Regular exercise, incorporating both aerobic activity and resistance training, is also crucial. Aerobic exercise enhances blood flow to all organs, including the penis, while resistance training supports healthy testosterone levels. If the journey to a healthier lifestyle feels daunting, consider starting with atomic habits, small, simple changes that are easy to commit to daily, as outlined in James Clear's influential book. Finally, and often overlooked, is the impact of chronic stress. While a certain level of stress can be motivating, persistent, unmanaged stress takes a significant toll on your entire system, including your libido and your ability to achieve and maintain erections. Prioritizing stress reduction through mindfulness, hobbies, or seeking professional support is not just about mental well-being. It's a direct investment in your sexual health and quality of life. Practice self-compassion, navigating performance anxiety and stress. When men encounter issues with their penis, whether it's concerns about size, appearance, or performance, they often become their own harshest critics. This self-judgment, combined with societal pressures and expectations, can lead to immense stress and anxiety surrounding intimacy. This anxiety, ironically, then amplifies the very problems it's worried about, creating a vicious cycle. For example, if a man experiences difficulty achieving an erection once, the next time he attempts intimacy, the memory of that past experience can flood him with apprehension, making it even harder to perform. This stress then solidifies the perception of a problem, perpetuating the cycle. It's crucial to understand that fluctuations in penile function are normal. Everyone, at some point, may experience an instance where their penis doesn't perform as expected, and that is perfectly okay. An isolated incident doesn't signify a permanent problem or the end of your sexual life. The key is to avoid internalizing these moments as personal failures. Unfortunately, many men feel unable to discuss these vulnerabilities, bottling up their stress and shame, which only exacerbates the issue. Practicing self-compassion, normalizing these experiences, and opening up to trusted partners or professionals can break this destructive cycle, fostering a healthier and more resilient approach to your sexual well-being. Use it or lose it, the imperative of maintaining intimacy. The age-old adage, use it or lose it, holds a surprising amount of physiological truth when it comes to penile health. If a man stops having erections, either during partnered sex or, critically, during the natural nocturnal erections that occur 3 to 5 times per night, it can have tangible physical consequences. These nocturnal erections serve a vital protective function, ensuring that the penile tissues receive regular infusions of oxygenated blood. Without this consistent blood flow, the penile tissue can begin to suffer, potentially leading to a reduction in length and the development of scar tissue, which can further impede future erections. Therefore, even if partnered sex isn't a regular occurrence, maintaining these natural, involuntary erections is crucial for preserving penile size and tissue integrity. Furthermore, your sex drive, much like any other physical drive, can diminish if consistently ignored or suppressed. If you avoid sexual activity for an extended period, your body may gradually decide it no longer needs that urge, leading to a continued decrease in libido. While this might be acceptable for some, it can become a significant issue within a relationship where a partner desires intimacy. The benefits of maintaining sexual activity and intimacy extend far beyond mere physical release. Regardless of age, sex and intimacy contribute to overall well-being, strengthen relationships, reduce stress, and can even have profound health benefits, as explored in Dr. Malik's other video, How Sex Could Actually Save Your Life. Making a conscious effort to prioritize intimacy, both individually and with a partner, is a powerful way to invest in your physical, emotional, and relational health. Remember, your health is your wealth, and you're absolutely worth the effort it takes to care for yourself.